All right, good afternoon, everybody. Pleased to see such a large group here today with us. My name is James Maloney. I'm going to be your Master of Ceremonies today, but before I get going, I would like to do a land acknowledgement and acknowledge that we are gathered on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples, and is now home to many diverse nations. So welcome, everybody. As I said, my name is James Maloney. I'm the Member of Parliament for Etobicoke Lakeshore, which is a riding just west of us. As my colleagues like to say, the best riding in the country. There's only one of them to defend themselves here today, but look, it's a real pleasure to be here with my friend and colleague, Minister Mark Holland, who I'll have more to say about in a moment, and Dean Laura Tam, who's kind enough to welcome us to this wonderful Faculty of Medicine or Dentistry at the University of Toronto, and a very special day. And we're going to hear from Minister Holland in a moment, who's going to share some great news with us. But I just want to talk about Mark, my friend, my colleague. I've worked with him personally now since 2015. We've worked arm in arm on a number of things. Mark has served as the whip to the Government of Canada, the House Leader of the Government of Canada. He was the Parliamentary Secretary prior to that for the Minister of Emergency Preparedness, and he now is our Minister of Health. And I can say with absolute certainty, and from my own experience, I have rarely worked with somebody who brings a level of commitment, dedication, and intensity to the job as Mark does, and he is perfectly suited for the challenges we face right now, and it's an absolute pleasure to work alongside of him. And I will turn it over to you now, Mark, and you can share the bright news for us today and the reason we're here this afternoon. So thanks very much.
Thank you so much, James. It's a wonderful pleasure to be here, James and I. This is an area of real passion for us. James and I are getting an opportunity to talk over the summer about going and talking to constituents who've been so affected by this program. So we're going to talk about numbers, but it is those personal stories and what's happening to individuals that I think is so impactful. I want to thank the University of Toronto's Faculty of Dentistry for hosting today. Dean Tam, thank you for your leadership, not just in helping in the CDCP, but making sure that we have that next generation of dentists to serve this nation. Oral health is so critical, and I think one of the other things that's happening as we roll this program out across the country, Dean, is that people are understanding just how integral oral health is to our overall health, and divorcing those two things, thinking about overall health is somehow different than dental health or oral health, is a mistake, and it's a costly one, because we know when folks don't have the oral health care that they need, this results in very serious complications. In fact, just to give you a sense of that, I was in Labrador, in Gander in Newfoundland, and I met with Dr. Redmond. Dr. Redmond was the first dentist in the country to participate in the Canadian Dental Care Program. And through his clinics, just since the Canadian Dental Care Program has been going on, they've encountered 3 individuals that they detected oral cancer in, just from doing those inspections. Those are things that wouldn't have been caught, and you wonder what would have happened. So it just gives you some of the taste of how important it is for this work to be done. Mais aujourd'hui, il y a des informations vraiment importantes pour les systèmes bucco-dentaires. C'est incroyable que maintenant, 2,4 millions de Canadiens et Canadiennes sont inscrits dans le programme national et plus de 650 000 Canadiens avaient à recevoir les services bucco-dentaires. Et dans chaque province, le pourcentage de dentistes qui sont inscrits dans le programme est plus que 50%. Au Québec, c'est 84% environ. Et ça, c'est vraiment important. And for me, when we're taking a look at these numbers province by province, you will recall in a place like New Brunswick, we weren't seeing the uptake that we wanted to see. In just a couple of weeks, we've gone from 40% of dentists participating now to about 55% of dentists. That means in every province in the country, we are now over 50% of dentists participating. And I'm pleased to be able to say nationwide that we have now crossed 80% of dentists who are participating. I can look at Manitoba. Manitoba had one of our lowest rates. It has now caught Quebec at 84% of dentists who are participating. Now, there's a number of things that we're going to do. We're not stopping there. For James and I, it's essential that every dental office is participating. We continue to go across the country, James and our colleagues, having conversations with oral health professionals about how we can make sure that we make this program as successful and as easy as it can be to use. So in November, we're going to be launching a paper-based form. I expect that that's going to be increasing the participation again. In November as well, we're going to be launching pre-authorization. That means that we're going to be able to deal with more complicated health needs. And that is something that we've worked very closely with providers to make sure that it's as easy to use as possible, so that when the professionals that Dean Tam and others are working so hard here to get into the field, that they're not bogged down with bureaucracy and difficult processes, but that these are in many ways leading the way to make private insurance easier as well, showing that we can reduce the amount of bureaucracy that's there, because the easier it is for practitioners to provide services, the more people that they can say. I'm also pleased today that we're going to be running a new ad campaign to encourage more folks to sign up. We've had phenomenal sign up in seniors. I mentioned that 2.4 million number, but we still have a lot of 18-year-olds and persons with disability we want to see getting care. So that program and that ad campaign that we're announcing today will be really important in augmenting those numbers. Also forthcoming is additional cohorts. We'll have more information on that soon. But today, more than 650,000, when you think about what those individual stories mean, the sense of dignity and pride. I'll end on this. I mentioned I spent about a week ago in Newfoundland and Labrador, Newfoundland rather, and getting a chance to go around in small rural communities. A lot of folks who hadn't heard about this program, folks who'd had the same set of dentures for 20, 30, or 40 years, the sense of awe and joy when they realized this program was going to get them a new set of teeth. People talking to me about not being able to chew their food properly, chewing with pain, the feeling of walking around with a smile they aren't proud about, realizing that with that program, this is changing. We want that for everybody. So for James and I and our entire caucus, we're committed to the work ahead and very encouraged by the progress thus far. Thank you so much.
Thanks, Minister. Look, Minister Holland is absolutely right. I could regale you with stories from people in my own community about the success of the program, but the benefits to the individual, and it's heartwarming and it is life-changing. So thank you, Minister Holland, for everything you do. I'd like to now introduce the Dean of this wonderful faculty. You can see behind us the enormity of this facility and the importance of the work that they do. And I can honestly say in my lifetime, I've attended a number of academic institutions and I've been at many of them. This is the first time I can truly say that this place puts a smile on everybody's face. So Dean, I would like to turn the mic over to you and you can share your thoughts on the program. Thank you.
Thank you, MP James Maloney, for the introduction, and to Minister Holland for joining us today. Good afternoon, everyone. We're happy to have you here in Clinic 2, the largest of the faculty's 14 dental clinics. Each year, we treat more than 15,000 patients experiencing barriers to accessing dental health care by providing costs that are dramatically lower than that of private practice. However, for many patients, that cost is still unaffordable. Programs like the Canadian Dental Care Plan align with our missions to provide dental care to those in need. We have accepted many patients through the CDCP since we've enrolled several months ago, and our experience continues to be positive. We are grateful to mark the CDCP as an important step for oral health care in Canada. As we provide care for even more patients, it's essential to garner support for the space in which we treat them. We are constantly making updates to our facilities to help us maintain our excellence in research and patient care while providing the best training for our patients. Later today, we will show Minister Holland our preclinical lab, which just underwent a renovation. And the space that we're standing in now is our next project for upgrading. It's vital that we maintain our spaces and ensure that we have the latest equipment that will help train the dentists of tomorrow and to treat the patients of today. On behalf of the Faculty of Dentistry, I want to thank the Government of Canada for helping us to improve access to oral health care across the country. Thank you.
Thank you, Dean Tam. Okay, so we have some time for questions. We'll go in the room first, and then we'll have some questions online.
Welcome everybody, bienvenue à toutes et à tous. I'm Minister Holland's press secretary. Je suis l'attaché de presse du ministre Holland. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and to whom your question is directed. You will have the opportunity to ask one question with one follow-up. Nous commencerons par les questions de la salle avant de prendre les questions sur Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Hey there, Marie Danielle Smith from the Canadian Press. My questions are for Minister Holland. Minister, Quebec has decided to move ahead with allowing advanced requests for assisted dying at the end of next month. Can I get your comment on that and whether your government is considering the possibility of legislating on it before the next election?
Well, thank you for the question. This is very late breaking. As you know, Quebec just announced their intention. I've had a number of conversations with different folks, different ministers in the government of Quebec. And what I've indicated is that we're going to take a look at the proposal. We're still evaluating it because we've just received it. And that it's important that we have a conversation as a society about the implications of this. There's enormous sensitivity. I can speak from personal experience. My grandmother was diagnosed with Alzheimer's. She lived with it for about 15 years. It was a tremendously difficult period for our family. These are very hard conversations for families. And it's a hard conversation that we need to have for a country, as a country. I look forward to those conversations and to reviewing Quebec's proposal, but we have a lot of conversation, a lot of work ahead.
Also wanted to ask you about the now defunct Supply and Confidence Agreement. There are several social programs listed there, not all of which have been fully completed at this point. Is your government still going to be moving ahead with some of those, including the Safe Long-Term Care Act, which I think has not been tabled yet?
Yeah, so look, I mean, I think you got to go back to, and I was the House leader when the Parliament first was convened, and we were really working on a case-by-case, issue-by-issue basis. And then became an opportunity with the NDP on a select group of issues to work together on the basis to have a supply and confidence agreement. It wasn't more than that. So the issues and priorities were shared. These are things that we deeply cared about, where we found intersection with what the NDP was caring about. Now, Jagmeet has said that he, for whatever reason, has decided he doesn't want to continue with that agreement. But I think the issues are still vitally important. The Safe Long-Term Care Act you referenced is one of them. The continued work we're going to do on dental care. We have a new cohort to roll out. We have the hard work of getting that 80% up to 100%. We have seen 650,000. We have so many more. I'm just in my area, the pharmacare legislation, which needs to pass through the Senate. So I think it's important to know we are squarely and continually focused on helping folks and trying to make things better in very economic or in very globally difficult times. The NDP has made a political decision, and that's theirs to do. But now we're operating on a case-by-case basis where I think Canadians rightly expect parliamentarians to be focused on the business of the nation, not on their respective politics.
We will now proceed to questions on Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
Merci beaucoup. Si vous êtes journaliste et que vous désirez poser une question, veuillez utiliser l'option de lever la main. If you are a reporter and wish to ask a question, please use the hand raising function. And we have CBC News. Go ahead, Marina.
Hi there, Minister Holland. Thanks for taking our questions today. Firstly, your National Caucus meeting is coming after months of MPs asking for one, and now it seems that many are not showing up at all. Several chiefs of staffs of ministers have also quit their jobs recently. So what, if anything, do you do to counter what seems to be a lack of enthusiasm in your party?
Well, Marina, thanks for the question. I'm on my way to Nanaimo right after this. I've been to just about every Liberal caucus meeting since 2004. Sometimes people don't come because they have other commitments. I don't sense that lack of enthusiasm at all. I've run this would be my 8th federal election. I can tell you that the consequences and the impact of this election have never been more large. I have never been stopped more as I travel across the country for people to say they're deeply worried about what they might lose or what the Conservative cuts might portend. And so we're moving towards a real conversation about what this country is about. And I think today is a great example of that. There will be a choice sometime over the next year about the kind of country we have. It'll be a question about whether or not all people have access to dental care or not. It'll be a question of whether or not we continue to build a national pharmacare program and where every single person who needs access to life-saving medication like diabetes and contraceptives can or not. Look, it's easy to criticize, and certainly Mr. Poilievre has done that well, but I have certainly never been more motivated in my life over 8 elections to counter what he would seek to do to this country. And I think the stark is enormous, the contrast is enormously stark. So, for my part and for the part of the folks I talk to, we're ready to do the work of this country, and then we're ready to adjudicate what kind of country we should have in the future, and we're welcoming that debate.
Just following up, when the NDP and the Liberals had this deal in effect, they had demands on you as a health minister for programs they wanted. The Bloc now seems prepared to prop up this government on confidence votes if its demands are met. So I wanted to ask, have you or other ministers heard from the Bloc yet with any specific demands?
Well, look, I'm talking to the Bloc all the time and to the New Democrats. Unfortunately, conversations with the Conservatives haven't been productive. They're mostly focused on politics and trying to cause an election. Look, we have an election every 4 years. That's what's supposed to be happening. In the intervening period of time, people have an expectation for us to get the business of the country done. We still have over a year left to get things done. And I think people expect us to be focused on the work of the nation. And to me, that means passing legislation. That means improving conditions for people. It means advancing some of the programs that I talked about. So we're willing and ready, where priorities are shared, to continue that work. And I think to other parties who are pining for an election, they have to ask, well, what's their end game here? I think it seems to be more about serving their interests than Canadians' interests. And that's really what we try to wake up, and I try to do every morning, is ask, what can I do? I get the extraordinary privilege and weight of being the health minister of this country. How can I work with my provincial and territorial colleagues, my parliamentary colleagues, to try to make things a little better? And I think that's where we should be squarely focused. And if there are parties that want to pass legislation where we have shared priorities and things can be made better, then of course we're willing to work with them. But those conversations are always happening, and were happening in absence of a happening even when the supply and confidence agreement was happening. Yeah, you want to say something?
Yeah, if I can just add to what Minister Holland said. Look, both Mark and I speak to my colleagues across the country daily, weekly, sometimes hourly, and I can tell you with absolute certainty that there is not a lack of enthusiasm. In fact, it's quite the opposite. People are enthused, they're excited, they're looking forward to getting back to Ottawa next week, to get back to Parliament. And on the second issue about the other parties, the question shouldn't be to Minister Holland or other members of the governing party who they're working with. The question should be to the Conservatives. We're there to work with everybody in the House of Commons to get legislation passed and to make the country run better. The question should be put to Mr. Poilievre and the Conservatives, why aren't you working with anybody else? Because all the other parties seem to be able to manage to do it.
Any other questions on Zoom? D'autres questions pour le Zoom? And with that, this concludes our event for today. Thank you very much. Avec ceci conclut notre événement pour aujourd'hui. Je vous remercie pour votre attention.
So much.